After you're discharged, you may experience some of the following common situations. You may need to take blood thinner medications after your surgery. Atrial fibrillation is an irregular heart rhythm that can be quite common after surgery. You may notice that your heart rate is irregular, or you may feel it beating irregular. Atrial fibrillation can be associated with increased risk of blood clots that may lead to a stroke. If you develop atrial fibrillation, you may be given a blood thinner to reduce the risk of stroke with this rhythm. The blood thinner will be reassessed at your follow-up with your surgeon based on your heart rhythm. It is possible you may not need to take them for a long time, but you should never stop or change anything without discussing this with your healthcare team. There are different types of blood thinner medications. If you are prescribed a direct oral anticoagulant, such as apixaban, Eliquis, Xarelto, or rivaroxaban, you will not need to get your blood work checked to manage your blood thinner. If you are prescribed Coumadin or warfarin, you will need to get your blood work done. This blood work is called an INR level, usually twice a week for the first few weeks. This will allow us to check to see if the dose you are taking is working for you or not. Your surgeon's office should receive the results and will call you if you need to adjust your medication. If you have had a mechanical valve surgery, you will need to take Coumadin for life. It is a life-saving medication. If you are on these medications, please look in your patient guide for more information, including side effects to watch out for, like increase in bleeding. Example, you may bruise more easily. Fatigue. Feeling tired after your surgery is normal. Your body will be using its energy to heal. As a result, the regular activities of daily life, like having a shower, can make you feel tired. You may need to have a rest afterwards. It can take up to 2 to 3 months or longer to really get all your energy back and to really fully heal after your surgery. Try to be patient and take it one day at a time. Give yourself the space to heal. Build your strength back up slowly. Keep doing your exercises to ensure you are getting stronger and increase them slightly each day. If you overdo it, you will feel it. It's a balance. You can follow your exercise program the physiotherapist wrote out for you in your patient guide. Difficulty sleeping. After surgery, some patients report some difficulty sleeping at night. If you have trouble sleeping at the hospital, you may also have trouble at home. However, once you are out of the hospital and in the comfort of your home, this usually does improve. It's important to try not to nap too much during the day. If you do nap, aim for less than an hour and not too late in the day. Also, be careful with the caffeine in coffee and caffeinated teas later in the day. Try not to consume them after 12 o'clock noon. During the first 4 to 6 weeks, you will be able to sleep on your back or very slightly on your side. Make sure it's just a slight turn to ensure you protect the sternum if you have a chest incision. If you wake up at night with pain, you can take some pain medication before you go to bed. Pain and discomfort. If you have pain in your first few days at home, use Tylenol as directed on the bottle or your prescription if you're not allergic. Do not exceed the maximum daily dose. It's important to take your pain medication regularly, as needed. You should take pain medication when you start to feel uncomfortable, so it does not become worse. This will help you do the daily activities which enable healing after your surgery. If you still have pain after taking Tylenol, you might be given a stronger pain medication. If so, this will be included on your prescription before you leave the hospital. Right after surgery, you will need to avoid anti-inflammatory medications for pain. Example, Advil, ibuprofen, or Aleve, unless they're prescribed by your healthcare team. They can interact with other heart medications and can also be hard on your stomach. Constipation. It's common after surgery to be constipated. It can also be a side effect of your medication. Make sure to eat regularly. Constipation can be caused by not eating enough. Walking helps too. Choose foods that are high in fiber, such as whole grains, whole wheat, multigrain, flaxseed breads, high fiber cereals, whole wheat pasta. Eat a serving of vegetables and fruit at every meal. Drink at least 6 to 8 cups, 1.5 to 2 liters of fluid of water per day. If you are on a fluid-restricted diet, follow your guidelines. If you don't have a bowel movement for about 2 to 3 days, you can ask your pharmacist and/or your family doctor to recommend a possible medication to help. Mild shortness of breath can be normal. After you get home, it should not be worse than what you experienced in the hospital. Continue your deep breathing and coughing exercises to help expand your lungs and help your breathing improve. If you have an increase in shortness of breath, please contact us. Hot flashes can also be normal after surgery. A fever, however, is not normal. A fever is 38 degrees Celsius or higher, measured with an ear thermometer. If you develop a fever, you will need to contact us or go to the emergency department if you're unwell. Forgetfulness or difficulty concentrating is common after surgery. You will need to give yourself extra time to accomplish tasks and ask for help if you need it. Mood changes. Most patients recover emotionally from cardiac surgery very well, but some people can experience mood swings during recovery, including feelings of anxiety and depression. Common signs of emotional distress include mood swings, difficulty sleeping, feeling overwhelmed, depression, anxiety, or crying for no apparent reason. If symptoms like these develop, talk with your family doctor about accessing support in your area. As well, the Heart Institute will be able to support you through our cardiac rehabilitation program with resources. For some of these programs, your caregiver will be invited to participate in recognition of the impact your challenges can have on your relationships. The contact information for the cardiac rehab team is in your patient guide.
Hi, I'm Joanne McNeil. I'm a dietitian at the University of Ottawa Heart Institute. Today we're going to talk about what to do when you're not feeling hungry. So sometimes after surgery, your appetite can decrease and you might not feel hungry. It's very important to eat well after surgery, especially protein, so even if you're not hungry. This can help your incision heal and can decrease your risk of infection. Here's some tips to help if you have trouble eating. Eat smaller amounts but more often. Try eating every 2 to 3 hours, so that's about 5 to 6 small meals throughout the day. Eat more when your appetite is the strongest, like in the morning time. And make every bite count. Eating half of a meal or 2 to 3 tablespoons is better than nothing. So some ideas for nutritious snacks include whole grain crackers with peanut butter or hummus, a piece of fruit with some cheese, maybe some frozen berries with granola and plain Greek yogurt, or an egg, chicken salad, or a tuna sandwich. Even a half a sandwich is great. Try milk or milkshakes, maybe some yogurt beverages, or an oral nutrition supplement like Ensure or Boost, instead of low-energy fluids like water, broth, tea, or coffee. Have easy-to-prepare meals and snacks on hand when you don't feel like cooking. Some good examples are granola bars, some nuts, some Greek yogurt, maybe some pudding, and cheese and crackers. Have fats and oils at each meal. Top your salads, vegetables, pasta, or rice with a few teaspoons of oil, such as olive or canola. You should also spread margarine or butter on your bread, your vegetables, and potatoes. This will increase the energy content of your food. Avoid reduced fat foods, such as foods labeled light, low fat, or fat-free. Try adding some powdered milk or even some protein powder to your soups. Breakfast cereals, maybe your puddings or your scrambled eggs, for extra protein. And if your appetite doesn't come back or you continue to lose weight, let us know and we'll refer you to a dietitian.
After surgery and discharge, some patients may need to keep an eye on fluid buildup in the body. This is for patients with a history of heart failure or those who have had a valve replacement or repair surgery. You will need to weigh yourself every morning before breakfast. Use the same scale and wear about the same amount of clothing every time. Write your weight down in the Surgery Weight Tracker tool calendar. If you're in the green zone, you are not gaining weight. You do not feel swollen, you're not experiencing shortness of breath or chest pain. Your symptoms are under control. If you move into the yellow zone, you may see a weight gain of 2 pounds in one day or 5 pounds in 1 week. You may have an increase in coughing and shortness of breath, You may also wake up at night with shortness of breath. Your medications may need to be adjusted. Call the Heart Institute that day to speak with your surgeon's office or the nursing coordinator to prevent an emergency in the future. In the red zone, you are short of breath and feeling unwell. You may be wheezing or feeling a tightness in your chest, even at rest. You need to sit in a chair to sleep. You may feel confused or disoriented. In this situation, you will need to go to the nearest emergency department. Don't be nervous if you feel all of this information is a lot to remember. Our cardiac surgery discharge tool will give you an easy-to-follow checklist of everything you need to do.
Hi, I'm Kim Twyman, a diabetes nurse at the University of Ottawa Heart Institute, and we're going to talk about diabetes before and after surgery and why it is so important. If your pancreas is not producing enough insulin or your body is not using insulin properly, an abnormal amount of sugar or glucose can build up in your blood instead of being used for energy. Insulin is the hormone that unlocks your cell doors so that they can use glucose, the fuel for our bodies. Excess glucose in your arteries can contribute to blockages that can cause damage throughout your body. All patients admitted to the University of Ottawa Heart Institute are screened for abnormal glucose using a non-fasting blood test called hemoglobin A1C or HbA1c. This test measures the amount of glucose that has stuck to the hemoglobin in your red blood cells. This level is a good indicator of your average blood glucose over the past 1 to 3 months. This test is not just a diagnostic tool, but a way for you to know how well you're controlling glucose. The lower the number, the lower your risk of complications. It's important to know your number. About 60% of our patients have abnormal glucose in their blood, and 25% of them don't even know. A hemoglobin A1C less than 6% is the non-diabetic range, which means you are well controlled. Keep up the great work. A hemoglobin A1C between 6% and 6.4% indicates you have prediabetes. You need to take steps including healthy eating and increased physical activity to delay or prevent type 2 diabetes. A hemoglobin A1C of 6.5% or higher indicates you have diabetes. When you have diabetes, you need to keep this number below 7% to decrease your risk of long-term complications. Heart disease is the leading cause of death for those living with poorly controlled diabetes. After your surgery, you will want to have the best glucose control possible to decrease your risk of infection and to promote healing. If you don't have a diabetes team, we can consult with you by phone to help you improve your glucose control. Just give us a call. During your hospital stay, you may meet with an inpatient diabetes nurse who will work as part of your team to ensure you have the best possible glucose control. If you have prediabetes or diabetes, you will be referred to a community diabetes education program for post-discharge care. This will be arranged close to your home where you can meet with diabetes educators one-on-one or in group sessions to learn more on how to manage this progressive disease. If you have diabetes and your hemoglobin A1C is greater than 7%, you will be referred to our diabetes clinic in the Heart Institute. Post-discharge, if you don't have a diabetes team, you will be monitored by an endocrinologist and a diabetes nurse educator. Our diabetes clinic offers a 1-year intensive management program that ensures you receive the correct medication to get you to target before you are discharged, along with a detailed diabetes management plan you will follow with your family doctor. Our automated telephone system calls you regularly for up to a year to ensure you are following the best possible management practices. If needed, our diabetes educator will follow up with you by phone. Our diabetes nurse educators are available for in-person and phone counseling until you start working with your team in your community. It is very important, if you have diabetes, to check your blood glucose at home regularly and to not ignore any high glucose readings. Sometimes after your surgery, your glucose can be elevated due to the stress from surgery. If you develop a glucose reading above 10 millimoles per liter or below 4 millimoles per liter, call your diabetes team that day. You can also call the Heart Institute at 613-696-7000 to connect with our diabetes team here. Keeping your glucose controlled will decrease your risk for infection and help you heal.
Your nurse will review your medications and prescription on the day of your discharge. After you fill your prescription, on the way home from the Heart Institute, it's very important to not miss any doses. If you are taking any medications before you come into the hospital, your pharmacist will review them and help you organize them so you can take them safely. The medication chapter in your patient guide has helpful information on common medications after heart surgery. It will briefly explain why you may be on these medications and include some common side effects to look out for. It's important for you to understand your medications. Before taking any over-the-counter medications, including natural and organic items, ask your pharmacist to check to ensure there are no negative interactions with your heart medications. If you have trouble remembering when to take your medications, speak with your pharmacist. They can help set you up with a system that keeps your medications organized. Usually, your prescriptions will be for about 3 months, but it does not mean that you stop all your medications after this. You will need to renew your medication. Your family doctor can renew your prescriptions in the future. Give yourself at least a week or two to renew your medications so you do not run out. Never stop or change a medication without first speaking with your healthcare team. If you need help with your prescription costs, you can talk to a social worker at the Heart Institute about programs that may be able to help you out. Here are some general additional guidelines following your heart surgery. Driving. If you have a sternal incision, we recommend that you do not drive for at least 4 to 6 weeks after your surgery. If you have a minimally invasive surgery through either an incision at the side of your chest or underneath your breast or your pec, we recommend you do not drive for at least 2 weeks. However, only your surgeon will be able to let you know when you can drive again at your follow-up appointment. Your follow-up appointment with the surgeon will usually be about 6 weeks after you are discharged. The surgeon's office will call you when you are home to make this appointment. Your family can drive you to your appointments, and you should wear your seatbelt when you are in the car. If you are driving for more than an hour, get out every hour and move around to keep your circulation moving well. This exercise also helps to ensure you do not develop any blood clots. Working. You will likely be off work for about 2 to 3 months, give or take, after your surgery. It depends on what kind of surgery you will be having and what you do for work. If you need a letter for your work or for insurance, your surgeon's office will be happy to help you out. You can call their office for this after you are discharged. At your follow-up appointment about 6 weeks after your surgery, you can discuss your return to work with your surgeon. Activity. Your exercise and daily walking program will be outlined in your Recovery from Surgery patient guide. Walking is one of the best things we can do for both our physical and mental health. Gradually increase your walking. You can use the physiotherapy discharge video to guide you through some of these exercises to build your strength. Nutrition. Good nutrition can help you heal after surgery, especially protein. Eat healthy, balanced meals to support your recovery. This can improve your outcomes and prevent infections. If you're not eating, please reach out to us. Travel. If you're thinking about traveling in the future, talk to your healthcare team and your insurance provider before booking to confirm eligibility. Sexual health. There aren't any clear guidelines as to when you can return to sexual activity after your heart surgery. Generally, you can resume sexual activity when you're able to go up 2 flights of stairs comfortably. If you have a sternotomy, which leaves an incision down the center of your chest, usually it can be about 4 to 6 weeks after your surgery, but make sure you protect the sternum bone and listen to your body. Please speak with your healthcare team if you have any questions regarding this time frame. If you're taking any medications for erectile dysfunction, please speak with your healthcare team before resuming them.